Move now to COVID-19 vaccines, and increasing access to and demand for the vaccines are the big challenges in our drive to vaccinate the nation against COVID-19. Effective communication about the safety of the vaccines also means complete transparency about any risks or deaths that may be linked to the vaccines. Now, 53 deaths are currently being probed in South Africa for possible links to the vaccine. 28 of those deaths have now found not to have been caused by taking the jab. In other words, there is no link at all. 21 of those deaths are still under investigation. I'm joined now by the chairperson of the National Immunisation Safety Expert Committee, Professor Hannelie Meyer. Professor, thank you very much for joining us. So 53 cases, 53 deaths in total, 28 ruled out as any possible link to COVID-19. I wonder if you could talk to us about this group of 53, I think it was, yes, that are, how are they, how did the people die? Were there many different reasons? What was the cause of death in the main in those cases?
Yes, thank you very much. You know, I don't know if you are aware of it, some of the viewers as well, but last week on Friday, SAHPRA launched a microsite where people can actually go and look at the adverse events that's being reported. And then they will also on the site see the number of deaths being reported. So this is an ongoing process, and that's why it's now like 53 deaths being reported. And as you said, so it's actually 32 that causality has been completed for. So of the 32, unfortunately, 4 cases are unclassifiable. So that means there was not sufficient information available to do a causality assessment. Of the 28 cases that you referred to, 6 of them, they died of COVID-19. So these 6 cases all either got COVID-19 shortly before they got vaccinated, or they got it shortly after they got vaccinated. So by the time that they were vaccinated, they haven't had the opportunity or their bodies yet to mount, you know, a sufficient immune response. The other 26 cases, coincidental cases, they were all people dying of other comorbidities. And they were also in the older age group. So when you are in the older age group, automatically, unfortunately, you know, the risk of dying is there for you. And then also when you have comorbidities, then you are also at a higher risk of dying of COVID-19. So those comorbidities were things like diabetes, hypertension, coronary heart disease. Some had COPD, lung disease, TB. So they were very, and most of them actually had more than one comorbidity. So they were very, in most cases, yeah, frail with comorbidities, yes.
Talk to me about the 4 cases that are unclassifiable because there's not sufficient data. What does that mean?
So in those cases, it would mean, for example, somebody dying, for example, at home or at the hospital, and the family would then refuse to have a post-mortem done. So in those cases, so for various reasons, which is understandable, so in those cases, then unfortunately, you know, the cause of death cannot be determined. And then you especially if a person didn't have, you know, a clinical record available, then it makes it very difficult because during the investigations, all possible evidence and information is collected. They also do then a verbal autopsy, you know, with the doctors, with the family members, so on. But if someone, for example, hasn't been visiting a health facility, then it is impossible to collect that data. So unfortunately, there are those 4 cases, yes.
So talk to me about the cases that you're still investigating. Just confirm how many deaths are you still probing?
So there are 21. So 21 of the 53 is currently under investigation. So this number will keep on changing, and we will be updating the website on a Friday or once a week, so I'd rather say. So this is an ongoing process, and remember, we are requesting people to report any possible adverse event following immunization. So it's not to say that there is, a temporal relationship it's caused by, but it must be investigated to make sure that the vaccines are safe, that there are no safety concerns. Yes.
I know that the anti-vaxxers will say, aha, well, you say it was a comorbidity, but how do you know it wasn't caused by the vaccine? How do you rule out the vaccine as a risk when looking at these deaths?
Yeah, so as I said, all the evidence must be collected, and then we go through a methodology where we look at, are there any other possible causes for the death? Do we have any literature which will confirm that this, whatever the person died of, could be caused by the vaccine? So it's a very scientific process, and we only work on evidence. And what people must remember, that the vaccine, the goal of the vaccine is to protect the person from severe disease and hospitalization and death of COVID-19. So the vaccine cannot protect you from, dying of your comorbidity. And we also look then at the background rates or the expected rates of death. So there's a certain expected rate of death, as we all know, in the country for certain age groups, for certain diseases, and so on. So those deaths will happen, irrespective of whether people will be vaccinated or not. And if you look at the older age group, the more people you vaccinate in that age group, the higher the number of people you will find who will die just because of they had a comorbidity, whatever the reason might be.
All right. Well, thank you so much for your time this evening. Chairperson of the National Immunisation Safety Expert Committee, Professor Hannelie Meyer. I'm just going to quickly break down the 53 deaths that are being probed, or probed rather. 28 of them have been absolutely definitively ruled out not to be linked to giving the vaccine. 22 people died of other comorbidities. 6 died of COVID itself, and that is because they probably contracted it before or very shortly after the jab. 4 have been unclassified, not enough data, families refusing post-mortems. 21 are still being probed. So lots of transparency around any safety concerns.